Great, thanks so much. One, just wanted to say good morning, and I am glad that all of you are here today. This looks a little bit different than how we did it last year. And so last year, I got to spend a whole week with all of you lovely educators and really get to know the challenges that you're facing, some of the goals that you had for the next year, and connect you with different resources that we could from a workforce development perspective and a health plan and healthcare perspective. So at first, I just like to say, I'm glad you're here. Please feel free to put on your camera. I'd love to see your face. We're going to utilize the chat box and we'll have somebody monitoring that. So if questions come up, please feel free to use that. If you need to grab coffee, you need to grab a cat, let the dogs out, let the kids in, please feel free to roam about the cabin. We're comfortable, we're casual, we're learning, we're here. So let's get right into it. I'd first just like to go over our agenda for our time together and how we're going to spend the next 50 to 55 minutes. We'll do some brief introductions of, I'd like to hear both from you, the educators, and who you are, and learn a little bit more about you and connect with you. And also have some good introductions from what I call my all-star panel that participated last year, and they just did a session this morning. So they're double teaming this morning, and then go right into our panel discussion. I have some preset questions that I'd like to go through and then really open it up to you and hear what questions you have for our panel and how we can provide you with resources and assist you in this process. So going on here, because you're educators and you know the drill, we're gonna do an introduction activity, icebreaker, warm up, whatever you'd like to call it. And because I have to practice what I preach, I'm gonna start off first and model that. So my name's Kate Lemke. I work with our workforce development team here at Banner University Family Care for our long-term care line of business. And I actually have, this is my second year doing this externship with Erin. So that is why I said yes to this, because I really value connecting with others and know that there's a lot of good dialogue that can come from sharing those personal stories. One thing that I like about myself, you might figure this out already, if not, you'll probably learn in the next 50 minutes, is that I'm silly, and I like that. And sometimes in the past, as I've been fielding candidates for positions, that's one question that I ask in the interview is, how do you do silly, and what does that look like? Because I know if we're not compatible and have that flexibility to kind of sit back and enjoy life and have a little playfulness, it's probably not going to be a good match. The work that we do is heavy enough, and we have to balance that out. My favorite tree is a white birch tree, and I will tell you that is because I grew up in the middle of nowhere, Wisconsin. It's so much the middle of nowhere. It's called Shantytown, Wisconsin, and it really exists. It's on the map. If you want to research it, you aren't going to find much. Some churches, some bars, and a lake, a couple of lakes. And my grandparents lived next door to us. So whenever I would spend the night at my grandparents' house, and sometimes I would get scared and miss my mom, I would come home in the middle of the night. And I knew that the middle marker between my parents' house and my grandparents' house was this white birch tree. And that really sticks out in my mind. And sometimes when I'm missing Wisconsin and missing my family, I just think of that tree. So one thing that I like best about my job is really connecting with people. I've always been a people person, learning stories, sharing stories, and connecting deeply. So at that, I'd like to open it up to everybody that is participating from an educator standpoint and have all of those folks go first, and then we'll introduce our panel. So feel free to take yourselves off mute and jump right in. Otherwise, I can go the teacher route and call out names.
My name is Jean Gowan. I'm a culinary arts teacher here in Tucson, Arizona. One of the reasons why I'm participating is I've tried to do this a couple years in a row, but I've always missed it for one reason or other. I did it just to learn some stuff, and just through the last couple of days, I've gotten so many resources, so many good ideas, and obviously there's a lot of connections, which is, you know, double plus good. The thing I like about my job the most, and it's really surprising because I'm from the culinary industry, is watching the kids really learn about food and watching them manipulate food, and then the look on their faces when they make a really good product. That makes me really happy. I'm not so much silly as I'm dorky. And the kids don't expect that because simultaneously I'm kind of strict, but then I can come off and be super dorky sometimes. My favorite tree is a willow tree. It just reminds me of my hometown back in New York. I think I covered everything. That's it. Okay.
Excellent. Welcome. Who would like to go next?
I'll go. Good morning, everyone. My name is Dr. Annette Wright-Smith, and I am the Pharmacy Tech instructor at Metro Tech High School in Phoenix, Arizona. That's part of Phoenix Union High School District. And I'm kind of quirky too and like to have fun. And one of the things I love most about my job is that prior to teaching pharmacy tech starting in 2003, and during that time, I'm a chiropractor. I'm a licensed chiropractor. And so I taught anatomy and physiology for a number of years to college students, and they weren't much fun. They didn't like my silly, kind of funny, offbeat kind of sense of humor. And they were very, very serious because it was nursing students, which they should be. But what I like about pharmacy tech is that I get to have fun with the students. We get to do a ton of hands-on learning. They like my funny sense of humor, my little quirky sense of humor. And I have like the best students in the whole school. I have students that are honors and AP students, so that's great. The reason why I particularly wanted to do this conference is because there's a state law that pharmacy technicians or pharmacy technician students cannot extern until they turn 18. And 3/4 of my junior and senior students don't turn 18 until after they graduate high school. So even though they have 30 college credits before they graduate high school, a lot of them have full scholarships to college, they can't get the hands-on opportunity that they need that will help them get a job in pharmacy tech without because of the age requirement. So I'm looking for creative ways to find externships for my students in all of healthcare and even outside of healthcare, just so they have that work experience and they can use that experience to move them to the next road, which would be a pharmacy tech or other allied health professional. And trees. I don't really have a favorite tree. I'm from the Midwest. I'm from Chicago. I have a favorite flower. I love all flowers though, so I don't really have a tree that I particularly like although I do like palm trees here, here in Phoenix. Anything else? Did I miss anything?
No, I think you got it all. Thanks for sharing the joy that you have in students. That's exciting to hear.
Thank you.
Who'd like to go next?
All right, I'll go next. I'm Caitlin McGill. I teach agriculture science to middle schoolers in Yuma, Arizona, down here on the border. Let's see. I found out this opportunity was presented to me via a Zoom meeting, and I thought, yes, that sounds great. I started a hydroponic garden in my ag class, and every opportunity that has been presented to me, I've just been taking, and it's been a really excellent ride so far. That's why, and let's see. One thing I like about myself is I also teach science in addition to agriculture, and I love all the science puns that I could come up with that I think are hilarious, and the students may or may not think they're hilarious, but at the end of the year survey, I pass out, but they appreciate it. So I think that's always a good time. And my favorite tree is the Palo Verde, because it's just so, I don't know, just like, it's so off, in my opinion. I don't expect green branches, so. That's it.
All right, well, thank you and welcome, Caitlin. Who would like to go next?
I can go. Good morning, everyone. My name is Vivian Knight. I am an accounting instructor at Pima Community College here in Tucson, Arizona, and I'm also the business department head. The reason I say yes to participate at the conference this week is because I think this is a great opportunity to connect with the educators as well as the industry partners. So this is a great partnership. We always are looking for ways for our college to connect with, all the industry people and working with other educators as well. What you like best about your job? I think that, I teach accounting. A lot of students really afraid of accounting. They think that accounting is just like math. They hated it. But once you can turn them and, they got it, I think it's a very rewarding experience. And I like to help students when I see them grow. And that's the best feeling in the world. So it's very addictive. I just can't, I couldn't find a better job than this. One thing I like about myself, well, I'm not sure about this question, but I guess, I always like to be positive. And I think that's provide me a great energy for dealing with any, headache, issues. My favorite tree, well, because I'm in Tucson, Arizona, we have a lot of holidays here. I like it, but I don't like to keep one in my yard because it's getting very messy. At some point, it's pretty, but I like it, but not having one. So that's it. Thank you.
Thank you, Vivian. Excuse me. Did all of the educators have a chance to introduce themselves? Did I miss anyone? I think that's everyone. If not, feel free to chime in. Next, I'd like to have our all-star panel introduce themselves. And Bill, would you like to lead us off?
Sure, Kate. So my name is Bill Kennard, and I'm the Healthcare Workforce Development Administrator for Access. And Access is the state Medicaid organization. We ensure that 1.9 million Arizonans receive health care through, as a result of their financial eligibility. Basically, we provide through contractual services, through the health plans like Banner, your host here today, with a range of providers throughout the state who provide services for acute and primary health care, behavioral health care, for children in the foster system, people with developmental disabilities, as well as the elderly and physical disabilities. We also have an extensive support an extensive healthcare system on the in the tribal lands. My role there is to look at healthcare workforce and their needs. So we look at kind of a range of not only healthcare professions, from licensed and as well as unlicensed professions. And, essentially we're really trying to help improve the capabilities as well as ensure the capacity that make sure that our healthcare system can reach out across Arizona and provide quality healthcare to people who need that healthcare. The thing I like best about the job, I think, is just really the healthcare right now is just a very exciting field to be in. I've always been in healthcare. I came from a background in rehabilitation counseling, but primarily in the education area at Boston University. And right now I'm sort of more in a regulatory kind of role, but what we're really looking at is how do you build that infrastructure to support the providers of healthcare and in ensuring that they've got a capable and sufficiently staffed workforce. I said yes to participating today because Kate asked me, and I pretty much do anything that Kate asks me to do or tells me to do. And I think, I was kind of looking at these things like, one thing do you like about yourself? I think, well, I always thought that the thing that my best characteristic is curiosity. And just, I've always been curious about a lot of different things. It's led me in a lot of different directions. And I'm not just kind of curious to find out what it is, but I really am curious about how you do it. So just kind of this, I just have this kind of, built-in learner sort of thing about me. Doesn't necessarily mean I'm good at these things I learn how to do, but it does mean that I kind of experience them. And being from Massachusetts, and I love Arizona now, but besides the ocean, the biggest thing that I miss is the falls, and particularly the swamp maples. You would see reds and yellows and golds when you looked out across the valley. And I truly, really love swamp maples. So, and it's a pleasure to be here. Thank you.
All right, thank you, Bill. Veronica, would you like to go next?
Sure. I'm Veronica Creel. I'm the Director of Customer Care for Banner Health Plans. We run the call center for our lines of business, but we do more than that, but that's what you'll hear us say most of the time that we answer our calls. I participated today because I participated last year, and I really enjoyed having conversations and getting to know, the educators in the community and sharing my story. It's a break from what we do on the day-to-day. So that was nice, and excited to join again today. What I like best about my job, the healthcare, you're going to learn something new every single day, and it changes. So it doesn't stay the same. I enjoy that. And I like solving problems and doing the investigation part of that, and kind of seeing how we can fix things and see that through. So that's really what I like about my job. And one thing I like about myself, I do like to have fun. I do like to dance. And I've always, since I was little, that's one of my favorite things to do. So that's what I like about myself. And my favorite tree, I was looking it up because I didn't know the name of it, but in North Texas, where I spent a good amount of time, it's called the Vitex tree. It's a purple flowering tree, and they have a lot of those there. So and purple is my favorite color. So that's why I like that tree. I think I covered everything, Kate.
Awesome. I learned a new tree today. That's exciting. All right. Roy, are you there? Would you like to jump in next?
Yes, absolutely. So hello, everyone. I'm Roy Torres. I'm one of the vendor oversight program managers at the organization. My favorite tree is the ponderosa lemon tree, not the ponderosa pine, but the ponderosa lemon. I really like that tree because it's a very practical tree. It flowers all year long. It produces fruit throughout the entire year, even in the winter. And it's one of those trees that you don't have, hundreds of fruit to deal with at one time of the year. You'll have lemons when you need them. So I said yes to participating today because I believe my experiences after high school will align with the experiences of many of your students. And I think it could really help you by understanding or giving you a perspective from my experiences. What I like best about my job is that I'm in a unique role where I can partner with the different departments within our organization to work with them to help bring the performance of the vendors that do work for them. So for example, our credentialing department subcontracts some of the credentialing work they do to other vendors to help us do that work. Well, I can partner with them to make sure that the vendor is meeting expectations and really bringing them to the next level. So I like that I can help have an impact on the organization and make help the departments perform a little bit better. And one thing I really like about myself is that I get to be silly. That before COVID happened, my cubicle was right next door to Kate's cubicle, and oh boy, we had the best time laughing about any little thing that would happen, or something awkward or unusual would happen. We would be able to alleviate it by laughing about it. I'd tell Kate, "Hey Kate, you will not believe what just happened." So I really like about that about myself, because I think it really helps me perform very well in my job and also helps me manage stress. So that's it for me.
Thanks, Rory. And yes, I definitely miss our laugh sessions. Sylvia, would you like to go?
I will, Kate. I'm Sylvia Parra. I'm going to say that the saguaro is a tree because I've had an opportunity to look it up now. From my prior session, I didn't know if it was a tree. That's my favorite. It's strong and it's luscious out in the desert. And in many sections of Southern Arizona, in Southern Arizona, we still have the pristine desert. I grew up knowing the saguaro by the name of Hashan from my tribe's language. I still periodically will refer to it as a saguaro, but it's to me, it's a Hashan. And I think what I like best about my job is the opportunity to help others move forward in their careers and the opportunity to help members in their most vulnerable stage of need. Members accessing healthcare are not at their best because something is needed and they may not feel well. I accepted to participate today because within the health plan, there are areas that are unknown to many people applying for jobs. And there are great opportunities for career growth within the health plan. And because we're constantly looking for staff and we have positions available today, I think it's an opportunity to get our name out with other things that we do besides what happens in a hospital. One thing I like about myself, I would say, is that I'm approachable. I make it a point that I won't condemn or react to negative information. And Veronica reports to me, I think my strongest reaction is yikes to just about everything. And people have to feel they're safe in order to be able to discuss openly. And I think I give that opportunity for most people. My role is the PHSO, or Population Health Services Organization Chief Operations Officer for Banner Health in the insurance division. And I play a role in ensuring that the operational areas are producing for both our members and our providers. Thank you, Kate.
All right, thank you, Sylvia, and everyone else. And really just wanted to echo off of what Sylvia said there, that our intention for our time here is to give you a brief view in what some of the entry-level positions at Banner look like, how you can take that information back to your students, and what that career path looked like for a lot of our panelists. So not only to give that health plan information to you, but to give you a format for conducting a career panel in your own classroom and give you those resources. So at that, I'd like to move into our panel discussion, and I'm really excited for this opportunity to curate these stories and learn more about how we can connect with you in the community and bring that information that you have as educators and bring that back to students and possibilities that they could have not only with the health plan, but healthcare in general, and what a career path for a high school and middle school student looks like. So I have a few preset questions that we're going to go through, but I also encourage you to think about questions that you might have. Utilize the chat box, and we'll have time at the end of the questions as well to jump right into those. So without further ado, my panel, if you want to jump in at any moment here, we're going to go right into our first question is, and did you have a role model? Who was that, and how did they influence you?
I can go first, Kate. This is Veronica. I have to say my role model was my mom. She held a few jobs while growing up, but graduated high school and I think worked for one of the credit unions here in Tucson, and was lucky enough to find a job with IBM. And she really worked her way up to becoming a quality manager. That's why we ended up moving to Texas for a bit while she was working for IBM. She worked for them for 25 years. And just to see her work ethic, just really, I could see it every day. It wasn't an easy job, but it had its rewards, and, you know, it had some some cons, but I think just to see her work as hard as she did really influenced me throughout my career. And I was really lucky enough throughout my career to find mentors that either helped me in learning the business or helped me to kind of navigate my way through my career path on a personal level.
This is Roy Torres. I have two different sets of role models. The first one is the role models in my personal life. And I give this example at the last session, which are my grandparents. As a little boy, I spent a lot of time with my grandparents because my dad worked at the mines and was gone for hours, sometimes even days at a time. And so I spent a lot of time with my grandparents, and I got to see some of the challenges that seniors face. And the challenges they have are very unique. They have challenges, understanding technology, the medications, making sure they're able to get their medications from the pharmacy, and overcoming issues with insurance, food, finances, all of that. And despite any challenge that crossed their path, they were very motivated to overcome those challenges. And they taught me about perseverance, to keep going. Even if there's a challenge that seems like you can't overcome it, you can find another solution or come up with a contingency to get around it and keep going. So that's really helped me out in life. In my career, I have two role models, one being Sylvia, our COO. She was one of the first people I ever talked to at the organization when I was first hired in the call center. Sylvia is very inspirational and makes all of us feel like we are equals. She kind of removes, even though she's my boss's boss, she kind of removes those hierarchical barriers that we often see in a lot of organizations. And she's really been instrumental in helping me realize that I can do what I set out to do, and to keep going, and to treat others well. And my other career role model is my current leader. Her name is Sarah. She's the Business Excellence Senior Manager, and she's really helped me a lot lately with helping to overcome challenges, when people don't quite do what you need them to do, or you face challenges with accomplishing something because, challenges created, with managing expectations of other people, things like that. She's really helped me a lot and helped me to navigate those challenges. And, I've been in this organization for going on 11 years now, and it goes to show that you never stop learning. There's always an opportunity to continue improving. So I give her a lot of credit for that also.
Hi,
When I was,
I'm next. I already introduced myself, but I wanted to say thank you to Roy. And I also wanted to say that I don't know if everyone has already read Molly's chat for the introduction. So I thought I'd just call it out. Go ahead. Thank you.
I think when I was in high school, there was a head baseball coach that I really admired, and the real reason I admired him is because he really created a system where he trained us in skills. So I really appreciated learning actually how to do things in baseball, but in a skillful way. But the thing that I really, when he became a role model for me, was kind of towards the end of my freshman year, and I was a pitcher, and so they had brought me up to the varsity to pitch a game, and I was nervous, as you might expect, and so nervous that I walked in 5 runs without getting anyone out, and the team was kind of rebelling on me, and thankfully, I saw the coach, come out from the dugout, and I was hoping that he was just going to pat me on the shoulder and say, "Hey, another day." And so he did. He came out and he said, "You're having a tough day today." And I said, "I am." And I kept trying to hand him the baseball, and he said, "Oh no, that baseball is yours. This is your game. You're going to pitch it, and it'll get dark and we can't play anymore, or we'll win, or something will happen, but this is your game to win or to lose." And with that, he turned and went back to the dugout. And I was left with kind of figuring out what the heck to do. And I ended up actually kind of surprising myself by suddenly throwing strikes. And the kind of really the reinforcer and why he really became the role model is, we ended up winning the game because I had walked everybody in. Nobody had actually hit me. So I ended up with a one hitter and a winning game, and kind of a life lesson that you just don't give up. So that's why he became my role model.
This is Sylvia. My role models, I had two. One was my mother, who gave me some very strong foundational upbringing and an aspiration to succeed. And the other was a school teacher I had my freshman year in high school. I was not on the career path for college, and within the first 6 weeks, he decided that I needed to be on the career path for college. So he walked me to the principal's office and said, all your classes are changing. And he changed all my classes and said, you'll have some catch up to do, but you can do it. And anytime I tried to take a different path that wasn't with what he thought my potential could be, he redirected me. And up to the point where when I selected a college, he selected the U of A, and he checked and got an application, and he sat me down one day after work and we filled out my application together, and he said, here, have your parents sign here. And we submitted the application. He never let up on me, and my mother didn't either. So I had two people who would push me when I said no, and didn't give me the opportunity to say no because they knew that I could. So those are my two role models.
Thank you. Let's go right into our next question here on the theme of career paths, as we're talking about that, whether you're in middle school, high school, or higher ed. Students and educators are talking about how to map that out and what those next steps are. What I'd like to hear from the panel is, how did you decide on a career path? And can you tell us a little bit more about where you were from an entry-level position to where you are now?
I could talk about that. I pretty much didn't decide on my career. I kind of had to get a job when I was like 15. My parents were like, get a job. So I started working in restaurants, and once you're in a restaurant, it's kind of a naturally organic thing to just learn from your chef and keep moving forward and going up and getting a better job. And, I didn't have time to go to school because I was pretty much just working, and I was lucky to travel. But it got to the point where I was a little bit older and I really didn't want to cook in restaurants anymore. And I'd always wanted to be a teacher, but I just never thought it was possible. And in the culinary industry, it's kind of like those who can't do teach. So teachers are, they used to be looked down upon. But I got to the point where I just couldn't go much further. And I got a job as a teacher here at Ironwood 11 years ago. And I don't think I really had a career path. I just kind of got lucky, and that's it. Here I am.
I'd like to go next if I can. I have an unusual background. My mother was a teacher, and eventually she became a principal, a vice principal, and a superintendent. My dad was a chiropractor that started off in medical technology. So growing up, I knew that I would go to college, and it was just a guarantee that I would work hard and do what I needed to do to get in college. When I went through my bachelor's degree, I was considering med school, and I was very, very afraid of taking the MCAT. So I said, oh, what other kind of doctor can I be besides a medical doctor, of course, and I knew about chiropractic. The first day of chiropractic school, The first instructor I had said the word doctor means teacher in Latin. And it is our hope that every one of you will not only teach patients, but you will teach as a career, you know, whether you're retired or after you retire from chiropractic, that you will teach others about healthcare. And so I thought that was really strange. I kind of laughed to myself. But the seed was planted that eventually, after my chiropractic career, or during my chiropractic career, that I would teach. And what I love about teaching is that I'm preparing the next generation of students for successful medical careers. I've had a very great medical career. I've done a lot of things as a chiropractor. I'm one of the first African-American female chiropractors in the history of Arizona. And now I feel that it's my duty to teach everything that I've learned about healthcare in 20 years and prepare my students and encourage my students, because a lot of them are first generation college students and their families. And so preparing the way for future nurses and doctors and x-ray technicians and pharmacists is really exciting. One of the things that I learned as a Noyce Scholar, which is a fellowship from the National Science Foundation that I received to teach, is that experiential learning and hands-on learning go a long way in the classroom. So I'm fortunate enough to do all hands-on, or a lot of hands-on, because I am a pharmacy tech teacher. But even as an anatomy and physiology teacher, even as a biology teacher, I feel that students learn best when they can engage in a very specific way in the classroom. And that's what I love about it. So I still have a few patients that won't go away. They keep telling me, you're my chiropractor, but I do that part-time a little bit when I can, you know, when schedules will work for that. But I'm looking forward one day to being at a Banner Healthcare, or Banner Hospital, or being at a Honor Health Hospital, and then one of the students actually be my doctor. I'm really looking forward to that. And I feel that they have great potential to do that and so much more.
That's really incredible. Thanks for sharing that. And, you know, it's really great to see some of these stories come full circle. Roy was in the session before this, and one of his teachers was actually participating in the externship. So kind of that same story of continuing that tradition of being a lifelong learner. Veronica and Sylvia, I know you guys both have a very unique and interesting story about where you started out in the health plan post high school and where you are now. Could you guys chime in on what that path looked like for you?
Yeah.
Veronica, you go first.
Okay. I don't think I decided on a career path. I think it decided for me, to be honest. After I graduated from the U of A, I was a clerk at a law firm, and I didn't really know. I got my degree in business management, so I didn't really know what I wanted to do at that point. They offered me to stay on and kind of learn litigation, and just really, I didn't feel really passionate about it. So I knew a friend that worked for the health plans and said, hey, you know, why don't you get your foot in the door and apply? And at that time, the only thing, I think it was maybe like a reporting specialist. And I said, you know what, I'm just going to try. I tried, I didn't get it, but the person that got that position actually had a clerk position. So they had that position open. So I got it. I was a claims clerk, which was basically kind of filing paper claims, making copies and things like that. But it was something new, it was something exciting. I didn't think I was going to do that after I graduated college. I think you have this idea of, I'm going to start my, career right away. And I didn't really know. So I stayed in that position for 6 months. And then I ran over to customer care, taking provider calls. Didn't think I was going to do that either any time in my career. But I did. It was a challenge. And after I became a representative, I became a lead. And then I became a supervisor. Then I luckily applied for the manager position, and I was able to get that position. And now I'm the director of customer care. So I've held every position in that department. Every time I applied for a position, even though I knew what the department entailed, what it needed, I you can ask Sylvia, I was probably scared every time that I got a new position, and not scared in a bad way. It was just something new, and it was exciting, and I just wanted to make sure that I did a good job, and I made Sylvia proud. She's been one of my mentors, and so and it's exciting to see how well we've grown. And like I said, I never envisioned that this would be my career path, but I'm glad it is. And so you kind of work with what you see in your different areas of growth, and I think you kind of guide yourself that way, and just kind of following your intuition at that point.
Thanks, Veronica. This is Sylvia, and I started off in the health plan when there were only 12 employees, and I was number 13 within the call center. I was hired as the senior manager for the call center, and after a couple of years, when the director position became vacated, I was approached by a peer and said, you know, the reason they haven't filled the director for the call center is because you haven't applied yet. And I was coerced into applying. She says, you're doing the job already, and they're not going to hire a director until you apply. So I did apply for the job, and she was right. I was already doing the job. I was selected to work to grow the department as our business grew. After that point, I was asked to take on supplemental departments and oversee them, which included outreach, our community outreach program. It also included our marketing department. It included our grievance and appeals department. And it also eventually included claims. And now I have other areas like Roy's team of vendor oversight and some of the operational accreditation areas. It's been 12 years, but I would say that about every 3 years, my role has changed or expanded. And I find that even though I went to school and I have a bachelor's in business administration and an MBA, I thought I was originally going to go into the marketing and retail arena. But because of my mentor in high school, who started me off on my career path, he had different plans for me. When I was in high school, he said, I'm going to train you as a farm tech. And in training me as a farm tech, I got exposure to healthcare. And when I went to go work in retail and marketing, after a year and a half, I knew that that wasn't the customer service touch that I wanted. But I did learn one great thing there. I learned customer service at its best from Federated Department Stores. So I was able to take what I learned in retail for customer service and apply it to healthcare, and work in an area where I found greater joy, because I get to work with Arizona's most vulnerable, the population's most vulnerable, in the arena that where people are needed. I recall at one point I was approached by the Indian Health Services, and I was because I am a tribal member, and I was asked to apply for the area director position, and I was told, you will make so much more money there. And I said, you know, when I took my job, I knew two things. One of them was that I was going to have to work really long hours, and the other one was that I would never get rich. And I said, and so far my employer hasn't failed me. So I am in healthcare, in an area where it's not necessarily for money, it's for what I want to do. Thank you, Kate.
Thanks, everyone. Well, I'm just looking at the time here, and we have quite a few questions still that I would like to get through. So I'd like to move on to our next question here. And if you do have questions that you're thinking of, please put those in the chat. What I'd like to move on to is just a couple bit more slides forward, Selena. I think it's number 10. And that is thinking about advice that educators that you can take back to your students. And some of the things that our health plan staff see is, what is the biggest turnoff when someone comes in to apply or interview for a job? And what does that look like even when you're looking at them on paper on a resume?
This is Veronica. Sorry, it's raining, so it's getting dark. But the biggest turnoff is just not, I think there's a couple of things, but not being prepared. That's one thing where, you know, you don't really know what you're applying for, and that you would be surprised of what comes out of applicants' answers when you ask them, you know, what do you know about, you know, Banner? And they'll give you some sort of information. But I think one thing I've learned in my career is, you know, doing your research and understanding what it is you're applying for, as well as, you know, having a resume that's not fully reviewed. We see a lot of resumes that are drafts of, or templates that don't, you know, that get really vetted before they submit it or give it to us during the interview, and kind of just the way that some applicants present themselves. And that kind of coincides with not doing their research before. I think that they, because it's a call center job, they think that it's an easy role, but in reality, it's very, we're in customer service. So like Sylvia said, we really want to help the members. You really have to want to be there and have the dedication to help other people kind of navigate their way through their healthcare.
This is Roy Torres. I don't have a whole lot of experience hiring individuals because most of the leadership positions I've had, the staff were assigned to me. But currently, I'm part of a group that's doing panel interviews for a project coordinator position that we're hiring in our business excellence team. And I'd say one of the things that's probably most concerning to me that when I'm looking at resumes is when someone hasn't been at a job very long and they have multiple jobs where they've been there maybe for a year. So it kind of gives the impression that person jumps to the next thing, or things don't go well routinely and they go to the next job. So those are things that's something that really stands out to me, is where they have a lot of jobs that they've been there for a short period of time for.
I think the thing that I've noticed over the, go ahead.
I was going to say that my biggest concern in the interview process is when applicants don't answer the question. And when we ask for specific examples, that applicants give a hypothetical response. So clearly outlining that either they're not listening to the question or that they're exaggerating their experience. And it really hasn't been a subject or an issue that they've dealt with in the past. I'm sorry, Bill, go ahead.
Oh, no, that's all right. Thank you. That was a good point. I think this turnoff, if you will, really created the need for me to change the way I interviewed. So it kind of, that's how much this, what I'm going to describe to you, vexed me. And the experience was that, you know, I assumed that when you come in for apply for a job, you need to get a job. You want the job. But what oftentimes I didn't get the sense of is, did you want to actually get my job? Not the job I was holding, but work for the company that I ran. And how I looked at that was, you know, what did you know about the company beforehand? So did you just kind of come in and kind of know the name and the address and what time to show up for the interview? But did you know something about what we did? And more importantly, did you have some idea, and could you talk about it, about what you would do in the job that you were applying for? And I mean, I kind of, you know, the idea was that I'm looking for people that I think I want to keep, and not necessarily that, you know, your intensity and your desire to get the job, but can you demonstrate to me that you have what it takes to really stay in the job and do well? And even if you're a little bit wrong, even if you've kind of got the wrong idea about the job, if you actually thought about it and kind of have an image and a vision about that and kind of communicate it, that just speaks much more loudly to me about your commitment and your desire to work for that company than just kind of coming in and saying, well, you know, in the past, this class, I could do this. I wanted to see a person basically say, you know, I looked at the job requirements, and here's how I would think about performing that job for you. And to me, the people who could do that were the people who lasted the longest and did the best.
Well, I just want to thank everybody. We're looking right at time here. I would like to just have one or two questions, if there are, from the educators while we have our panel in front of us. Does anybody have any questions that they'd like to either type in the chat or take themselves off of mute and ask out loud? All right, it looks like one question came in the chat, and we just have about a minute before we have to wrap up here. But the question is, how important is a cover letter and a thank you note?
I am surprised when I get thank you notes. It's a nice touch. It really is. It makes us feel like you paid attention in the interview, and that you're really interested in the position. Cover letter is nice. I wouldn't say it's probably, from my perspective, it's not the most important thing. But either doing both or either one of those makes it feel, or I feel like you're a little bit more dedicated than others.
I would agree. Cover letter and thank you note, big.
I agree. I think that they're important, and oftentimes those who interview you are not the ones who get it. It'll go to, especially like with a large corporation like Banner, it'll go to the recruiters. But I know that the recruiters, when they get those, because they're scheduled, if they see another position and your resume is out there and you weren't selected, they'll reach out to you and say, hey, we have something else that you might want to consider. So it gives you because of that.
And it looks like we might just have time for one more question. I'm that salesperson, but I'm like, but wait, there's more. So how can someone get the experience needed when they have no prior experience in that particular field?
Veronica?
It's a good question. I've been thinking about it. I think just from my perspective and my experience, you kind of have to go for what's out there, and it may not be exactly related, but you learn a lot from maybe being in the same company and putting yourself out there and learning different aspects, even though it might not be exactly what you do in your role at that point in time. But I can tell you I've learned many things about different departments just in being the role that I am right now. So I think if you get the opportunity, take the chance, and then you don't gain exact experience from what you would want, but you're gaining experience somehow.
All right, thank you. And if anybody does have any more questions, feel free to put them in the chat, and we can get a response back to you. Just wanted to do a couple housekeeping items. You guys are going to be moving on to your next session. Want to thank our panel members for being here and our educators for taking the time out of your day to participate. I know that there is the feedback and review session tomorrow, and Erin, I think in the externship catalog that our contact information is in there. Yeah. And we can put this PowerPoint in there. There's a lot of questions that I have in a template that you can use to facilitate your own career panel in your own classroom, so you can walk away with that resource of how to engage your students in these types of questions and connect with our health plan specifically. All right, unless there's anything else, thank you for being here today, and enjoy your next session and have a great rest of your day.
Thank you.
Thanks, everyone. Thank you so much.